placed upon them as a result. I want to thank the young people who have enrolled into this program for the work they have done so far. Many areas in our neighborhood have been cleared and blocked drainage systems have been opened. However, even as we acknowledge the good work by our youth in this program, we have also observed a disturbing behavior by these youth, some of these youth, whereby some of them are forcefully demanding money from individuals within the neighborhoods that they are cleaning. I want to appeal to them to respect the original intention of the program and to remind them that this is not only unacceptable, but it is also unlawful to demand money, and that they should refrain from such practices. I want to appeal to this youth that each and every one of us must put our right foot forward, and we must do what we can to contribute to this fight, rather than do things that will mar the experiences of combating this fight. I am equally concerned about the youth who are harassing and robbing commuters under the pretext that such commuters are not wearing masks or are not observing social distancing. I think that youth are concerned about these adherence of these measures is a good thing, but they must work within their limit. They cannot act as police and enforce some of these things. They can encourage the citizenry on observing these measures and adhering to these measures, but they would be going too far when they start harassing and robbing commuters under the pretext that they are enforcing the measures that the government has put in place. I want to remind our young people that they are the ones who should lead this fight from the front by example and proper example and in the right way. Should they continue to behave in this manner, we run the risk of lowering the level of compliance, which has the potential to negate the gains that we have made so far. We have also observed that some businesses operating within areas where movement has been restricted, and we know that these are the counties in the coast and northeastern region and localities within the cities of Nairobi and Mombasa. These businesses within these areas are taking advantage of the situation by hiking prices of commodities and other essential goods that they are selling. This is totally immoral, and it is very shameful if we as Kenyans take advantage of a bad situation to profiteer from it. Indeed, we are in hard times. Many activities have been stopped. Gainful economic activities are suffering. But these are the sacrifices that each and every one of us must live with. Businesses, those that are operating, may not be operating at the levels that they were doing so, and they may not be registering the profit margins that they were used to. I think this is the time for Kenyans to stand up and take the sacrifices. This applies to business people as well. This is the time to review those profit margins and reduce them so that you stand in solidarity with those who are affected. I want to appeal to these vendors to be more considerate, as these are not normal times. As we have said repeatedly, this is the time that we must be each other's keeper. Yesterday, we informed you about a team that went to Kajiado on a tour and fact-finding mission to ascertain the measures that are needed that we have put in place to curtail cross-border transmission of the disease. Arising from that visit, I want to report that we shall very soon be receiving a mobile laboratory from across the border, courtesy of the East African Community, a program within the East African Community that aims at improving disease surveillance within the member states. This is a program that existed before. It just so happens, perhaps in a very fortunate and timely way, that the elements of this program, which include providing mobile laboratories to the member states, is happening at a time when we really need it at those border points. So through this program, we shall be receiving 2 mobile laboratories for Kenya, and these laboratories are fully equipped to do molecular work and the work that the testing that we are carrying out for COVID-19. And hopefully within the next week, we shall have one of these labs stationed and operational in Namanga so that we can address the testing of truck drivers at that border point. This facility will be key in surveillance and monitoring of the virus in this region. This is an area that we have now classified as a high risk based on COVID-19 positive cases detected at border crossing points. In our last update yesterday, we informed you of the need to continue with our vigilance. We must observe the containment measures in order to bring the numbers down. I appeal and repeat again that adhering to the measures that have been put in place, which include the personal hygiene measures of hand washing, wearing masks, keeping social and physical distance, observing the curfew, and staying home unless essential, are very important in breaking the cycle of transmission. And we cannot tire from this exercise, because if we tire or if we will become complacent and let our guard down, the virus will overtake us. So I appeal to fellow Kenyans, please let us observe all of these measures. It disturbs us when we see life seemingly appearing to be normal back to the times, the pre-COVID time. As we have said before, these are not normal times. And we really need to observe these measures. I now report on the findings of our lab testing over the last 24 hours, where we have tested 1,516 samples, which brings the total number of samples tested so far to 35,432. Of the samples tested today, 22 have tested positive for coronavirus. 21 of these are Kenyans, and 1 is a Uganda national. The youngest is 20 years old, while the oldest is 81 years old. 17 are male and 5 are female. We also collected and tested samples from truck drivers from Tanzania at the Namanga border point on the Tanzanian side. 25 of these samples tested positive for coronavirus. 23 of these are Tanzanians, 1 a Rwanda national, and 1 a Uganda national. As I mentioned yesterday, we do this testing on the other side, but those truck drivers remain on the Tanzanian side of the border on Tanzanian soil. The 22 positive cases detected in the country are distributed as follows: 10 cases from Nairobi, 8 from Mombasa, 3 from Kajiado, and 1 from Bomet. This brings the total number of those who have tested positive so far to 737. You will note that Bomet now joins the rank of counties that have recorded a positive COVID case. This brings to 20 the total number of counties so far affected. The spread of the positive cases by estates is as follows. In Nairobi, Embakasi has 4 cases, Kamkunji 3 cases, Kibra 2 cases, and Kenyatta National Hospital 1 case. In Mombasa, we have 7 cases from Vita, 1 from Nyali, and 1 from Nyali. In Kajiado, the 3 cases are all from Namanga. I would like to report today that we have discharged 22 people from the hospital. This now brings to 281 the total number of recoveries from COVID-19. We thank and honor our healthcare workers for their dedication and commitment in service delivery for us to achieve these recoveries. It always pains to announce a death, but this pandemic will claim lives. I sadly announce that today we have lost 4 patients to COVID-19, 3 here in Nairobi and 1 in Mombasa. This now brings to 40 the total number of those who have lost their lives from the COVID-19. Our heartfelt condolences go to the bereaved families and friends. Thank you. Tell them to speak loudly, yeah? We can't hear. Yeah?
Sometimes don't hear. Please raise your volume so that can be heard, or your voice that can be heard.
Well, my name is Chemutai Goin from Citizen TV. In a report presented to Parliament, the Health Committee, the National Assembly Health Committee, KEMRI is seeking 950 million shillings to buy reagents, to buy some of the equipment. To what extent is this sort of affecting your bid to carry out mass testing and even just to test? And then the second question, the U.S. Embassy in Tanzania has raised concerns over the fact that the Tanzanian government is sort of keeping the numbers or sort of mumbled, is not coming out clearly. Already from what you've presented, the cases in the border are really rising. What is the Kenyan government doing to contain this, especially even with calls made to close the border?
Maybe on the same note with the Mheshimiwa, with what Goin has actually said, the government actually intends to put up a mobile laboratory at the Namanga border. But this comes even with the Tanzanian government still hesitant or doubting about the existence of the coronavirus in their country. Do you feel as a country, to some extent, we are actually cooperating very well with the Tanzanian government in the fight against COVID-19? And what if they are actually going to be so much hesitant with maybe placement of such kind of a facility at Namanga border?
Thank you very much. Mark Namaso, KTN News. I'm asking about the cost implications of testing. Yes, my question concerns the cost implications of testing truck drivers. How much are you charging Kenyan drivers and how much are you charging their Tanzanian counterparts?
Okay.
Asante sana Kanali kwa hii fursa. Naitwa Boni kutoka Aero TV. Katibu, ningependa kujua visa vya maambukizi vimepungua ama hatujavisikia upande wa Kawangware na Isili. Ni kwamba hamjafanya kupima ama nini kinaendelea? Asante.
Okay.
Question in regard to testing. The CS Balala had announced that you're going to subsidize testing for restaurant workers. A bunch of restaurant workers have tried to take their staff for testing, and the 1,000 testing is not available. So perhaps you can let them know where they can find this, or if it's not available at all at this time.
Okay. Thank you. Let me start with the question by Chemtai of Citizen regarding the statement presented to Parliament, where you say KEMRI is claiming certain sum of money. I think it's actually 790 million and not 900 and something. I've seen that report. And how does this affect our testing? I don't want to delve into the matter that is in the report, but I will respond to the question as to whether it is affecting our testing or not. As we have said, our testing program encompasses several testing centers. The National Influenza Center within the National Public Health Laboratory is one of those. KEMRI Laboratories is another one. And we have several other testing facilities within our national referral hospitals, within our research institutions that are spread over the country, and within the laboratories of our collaborators who are working with us across the country. And for most of these laboratories, for the COVID-19 response, the government has developed a resource plan for not only testing, but for all the requirements that we need for the COVID response. The so-called COVID response contingency plan. And in this plan, we have quantified and earmarked resources that will go to various activities. Since we're talking about testing here, I can tell you that we have earmarked resources, we have quantified, and we know what are the resources we require for testing. We have been able to get resources for testing through the resources that the country has mobilized so far. And if you will note, you will see that our testing levels have continued to increase despite the constraints that I have mentioned repeatedly in terms of getting the reagents and other products. So what I want to say at this point is that our testing ability is not going to be constrained because of lack of resources to buy the reagents. Rather, it will be a lack of being able to access the reagents. I am, however, happy to announce to you that yesterday we received a consignment of 8,000 tests for one of the instruments that we use. And today we're expecting another almost 18,000 tests for that. And we have several of these tests that we have now been assured are in the pipeline that we shall receive another consignment by the end of this month, and we shall receive another consignment during the month of July. So I think in terms of the reagents for testing in the lab, at this point in time, we have sufficient reagents to be able to do the testing and the targeted testing that we want to do. This now brings me also to answer the last question that was in Kiswahili on Kawangware and why is it that we are not doing any more testing or reporting cases in Kawangware. With the consignments that we have now, we shall be going back to some of these high-risk areas. We shall also be going to new high-risk areas that we have identified. So I believe that in the coming days, as we expand our testing, our aim is really to be able to follow the maps, the risk maps that have been created based on the cases that we have seen, to follow those pathways and to get a better picture of really what the level of transmission of the virus is in some of these areas. It is because of this type of approach that we have been able to see what is happening in places like Isli and Old Town, and there could well be other places that there is some level of circulation that will only be revealed once we go in there and do the targeted testing. You can see we have now focused on the border points, especially in Namanga, and you can already see the kind of numbers that we are getting and the worry that that creates for us. There was also a question about the U.S. Embassy putting out some information there. There's a lot of information that we have seen also in the social media regarding the situation in our neighboring country. I do not know the veracity of this information and cannot comment on it. All I can say is that Tanzania is a neighbor, it neighbors us, and it is a member of the East African community. And as members of East African community, we work very closely, we collaborate with each other, and we are people of one region that work together. So our role as a government in Kenya, in addition to our regional interests, is also our national interest of protecting our people. And we will continue to do and protect our people in this COVID-19 response. And that means that we will test people who are entering our country. So that mobile lab, which somebody said was asking why is it to be put in the Tanzanian border if the Tanzanians are not going to accept our results. It is for our protection because we will test people who are coming in. And I think in time also I'm made to understand that Tanzania is also planning to equally have testing programs on their side of the border. So as a government, we will continue to do that, to test the border points, entry into the border points. We will also test, as we said, our truck drivers from the point of origin because they also trek through a corridor and will be spreading the virus, and it's good to know their status before they start their journey. So we'll continue with those programs of testing. I will also ask the DG to comment on that when I finish answering some of these questions. So I think I have responded to the testing and the issue about the mobile lab in Tanzania. The cost implications on the truck drivers, I'll leave that to the DG to respond to. And I think it ties in with the issue of subsidized testing for the restaurant and hoteliers, restaurateurs and hoteliers. So I'll ask the DG maybe to add a word or two to what I have said.
Well, thank you, CS. Just to add to what Waziri has said, of course, Tanzania is a good neighbor. We are members of the East African community. And we are also members of the global community, including the World Health Organization. In accordance with the International Health Relations 2005, we are all obliged to report cases of COVID-19. And as a country, Kenya will continue to report, will continue to test, and report on the cases that we get. And likewise, we expect our neighbors to continue to do so as members of the WHO. Of course, placing the mobile lab in Namanga was one to be able to address the snarl-up at the border and also to ensure seamless movement of cargo from our neighboring country, from Tanzania to Kenya and vice versa, And we had agreed that even before, when we said that we are closing even the airspace, that cargo will continue to flow because we'll still have to eat. So it was just imperative that we place that lab in Namanga. But if a decision is made otherwise, for example, if that border was, for one reason or the other, not to continue functioning, that is the beauty of having a mobile laboratory, because you simply move it to another desiring site where you can deploy it into immediate use. In terms of the testing for the restaurant workers, the hoteliers, and the truck drivers, we had agreed that as a committed government, this will be a subsidized rate of 1,000 shillings for both the truck drivers and the restaurant workers. But basically, it is a subsidized price because the actual cost of the test is much more. We have not begun the testing of the hoteliers and the restaurant workers because in our meeting on Monday with the Cabinet Secretary for Tourism, Honaji Balala, we agreed that we are going to work with their respective associations, including Public Entertainment, Restaurants, and Association of Kenya, to be able to develop standard operating procedures based on the guidelines and protocols that we had issued before. So we agreed that on Monday, we are going to finalize these standard operating procedures, not only for restaurants, but also for hotels and also for accommodation facilities, so that we address this matter in a wholesome manner. And once we do the SOPs and we sign them off, then we shall begin the testing of the hotels and restaurant workers. Of course, the testing of the truckers has already commenced, and as information that we have shared with you, if you look at the disease burden from our neighbors, then you see that we have a big challenge. More so that these are people who are captured through our formal border point at Namanga, not forgetting those who come through the porous or Panya routes, whom we may not be able to access. And it is imperative again that we appeal to the people along our borders to be very vigilant and to be able to report on any suspicious movement from our neighboring countries, to be able to bring that information quickly to the security apparatus and the healthcare workers, so that we can be able to map out the specific interventions to ensure public health security of the Kenyan people. Asante.